Female genital mutilation is known as the cutting of the female genitals for non-medical reasons. Although FGM is a violation of human rights and gender inequality, it is still practiced in about 29 African countries and the Middle East as well. More than 130 million girls and women are affected by female genital mutilation. The most common age for young women to undergo this procedure are between 3 and 15. Oftentimes, these young women do not have a choice to become circumcised because their parents force them to. Many times, girls are forcefully held down and their legs are pried apart. Usually, the midwife cuts their clitoris with a razor blade or other sharp utensils, which are often unclean or unsterile. These unsterile utensils can cause severe pain, shock, excessive bleeding, bacterial infections, urine retention, open sores in the genital region, and injury to nearby genital tissue. Most long-term consequences include urinary tract infections, cysts, infertility, increased risk of childbirth, complications, and a need for later surgeries. FGM is classified into 4 major types, the most popular being clitorectomy, which is the partial or total removal of the clitoris, excision, the partial or total removal of the clitoris, and the labia minora, without excision of the labia majora. The third being infibulation, the narrowing of the vaginal opening through the creation of a covering seal. And lastly, the category other, which are any other harmful procedures to the female genitalia for non-medical purposes, such as pricking, piercing, scraping, etc. In many cultures, FGM is believed to reduce a woman's libido and believed to help her resist illicit sexual acts. It is also associated with cultural ideals of femininity and modesty, which include the notion that girls are clean and beautiful after the removal of body parts that are considered male or unclean. There have also been efforts to eliminate the practice of FGM. In 2008, the World Health Assembly passed a resolution on the elimination of FGM, emphasizing the need for concerted action in all sectors such as health, education, finance, justice, and women affairs. The World Health Organization efforts to eliminate FGM focus on 1. Strengthening the health sector response with guidelines, training, and policy to ensure health professionals can provide medical care and counseling to girls living with FGM. 2. Generating knowledge about the causes and consequences of the practice, how to get rid of it, and how to care for those who have experienced it. And 3. Increasing advocacy, such as developing publications and advocacy tools for the international, regional, and local efforts to end FGM within a generation. Most recently reported in December 2012, the UN General Assembly adopted a resolution on the elimination of FGM. The root of all female genital mutilation are religious, cultural, and social, yet this intentional pain to the female genitals should not be accepted by society. We should all help end this harmful procedure that affects thousands of women around the world.